إن الحمد لله والصلاة والسلام على رسول الله وعلى آله وأصحابه ومن والاه. Brothers and sisters and friends from different countries, Assalamu alaikum wa rahmatullahi wa barakatuh. In our first video on Islam and the COVID-19 problem, we discussed the issue of problem identification in the light of the Quran and the Sunnah. And we stressed the point that problems that have national or global reach, that's these type of problems cannot be addressed as if they are clear-cut, straightforward and simple. We stressed the point that Islam has advised us to address problems as having multi-dimensions. In the case of the COVID-19, we stress the fact that this pandemic has a religious dimension, a policy dimension, economic dimensions, a media dimension, and also a geopolitical and global stakes and dimension that need to be considered. And in this video today, we're going to be talking about one of those dimensions, which is the dimension of public health and data. Why do we have to consider public health data when we address the problem of Islam and the COVID-19 pandemic? For a simple reason. Because Islam tells us that decision making in Islam cannot be based on personal opinions, on personal interpretations, on personal appreciation of issues, but decision should be based on evidence, proof, and data. This is a basic principle of Islam and Islamic law. Any decision that is made on simply on personal opinion, personal appreciation of things is null and void. Decision, and especially decision that pertains to the wider community, must be based on reliable data, proof, and evidence. Now, let's go back to the basics. What do the Quran and the Hadith tell us whenever we are faced in a situation where we hear of things, or we've listened to news and we've listened to media, and then we have to make decision? Now the Quran in Surah 49 verse 6, Surah Al-Hujurat verse number 6, Allah says, يا أيها الذين آمنوا إن جاءكم فاسق بنبأ فتبينوا. O believers, whenever a news reach you from a source which is of dubious character, or which is of unreliable source, so investigate it. Basically what the Quran is trying to tell us is that whenever we have a news, whenever we get information from people who are fasiq, who are of unreliable character or of unreliable sources, our duty as believers is to investigate, meaning examine, cross-check, verify the news that you're getting. Now, as I said in the first video, in my conversation with several Muslim leaders across the world in different countries, when we've been talking and asked them about the decision to close down, to lock down mosques, etc. So, and I've asked them, on what evidence, on what basis have they took the decision to close down mosques, to cancel prayers, etc. Now, the answers in many cases has been, well, we've listened to the news and we've listened from the media, we've listened to the news and the media, and so we've took the decision to close down the mosque because that is what the authorities have been advising, etc. Now, the issue here is, can we rely on these media? To what extent are these media reliable for us to base our decision on them? Now we know that the media, those same media, have consistently lied. Blatant lies have been proffered by these media to us. So we know, for instance, that these same media lied on the war on Vietnam. They lied on the in the first Gulf War. They lied in the second Gulf War on weapons of mass destruction. They lied in the invasion of Afghanistan. They lied again in the Israel and Palestinian conflict. And they keep on lying. And we have dozens of researchers, books, monographs, and articles written on a number of lies that the media, those same media that we are listening to now. So what the point here is that the Quran advises us to investigate, cross-check and examine whenever we get news from sources that are unreliable. This is our duty. This is what the Quran tells us to do. Now, the Prophet himself has actually put into practice what the Quran said. If we look at the seerah of the Prophet, we would come across the instances where just after the Hijrah, when the Prophet was in Medina, now he's at the very beginning of defining, of setting, of laying down the foundations of an state, of the Islamic State. Now several decisions have to be taken by a statement by the leader of the Muslim community. Now when decisions have to be taken for the benefit of the whole Muslim community, what did the Prophet do? Now this is a sunnah of the Prophet which unfortunately many Muslim leaders have simply ignored, set aside. What the Prophet did was that he sent several missions, several troops, several expeditions for precisely to collect information. So in the seerah you will find these written as Sariyah. For instance, you have the Prophet sending, for example, the Sariyah of Ubayd ibn al-Harith, the Sariyah of Hamza, of Sa'd ibn Abi Waqqas, of Abdullah ibn Jahsh. What were these expeditions meant to do? These troops and missions were sent to different parts, and there are hundreds and hundreds of instances of them where the Prophet have sent these people to different parts of Arabia, around Medina, precisely for the purpose of gathering information. Observe, gather information, look what is going on, then coming back to the Prophet and report what you've found, what data you've gathered, what information you've collected. It is only on the basis of these data of information that then the Prophet sits with his companion after the Asr prayers, and each one of them feeding him reports of field information, of field data, and on the basis of these he took decision for the benefit of the whole Muslim community. And it is this sunnah that the Prophet has taught us to put into practice whenever we have to make decision for the collective benefit of the Muslim community. It must be based on data and on reliable information. It is in this context that later on, with this process of gathering data, field data, observation, coming back to the Prophet, reporting, and then the Prophet make collective analysis and discussion, that the Quran later on revealed in Surah 42 verse 38, Surah Ash-Shura, and Allah says, وَأَمْرُهُمْ شُورَى بَيْنَهُمْ. And their affairs that pertains to all of them, their affairs is a matter of collective consultation among them. So decision making, brothers, when it pertains to the whole community, is a process where it is a shura, it is done collectively on the basis of field data. So in this context, the question here is, Did we actually follow the prophetic sunnah and the Quranic guidance when we made decision to lock down mosque, cancel prayers? Have we actually consulted and discussed and analyzed data together with all the stakeholders, and then we collectively took a decision to the benefit of the Muslim community? Or has it been a case of people having connections here and there with politicians, and politicians telling us, okay, do this and do that, and then we took decision just because we are leaders? And so I cannot answer to these, but what I can tell you is that the data at the time that the decision were taken, the data do not actually reflect the draconian decision that have been taken. So let us take a look at these data to see, these public health data to see what has been actually going on. Now, in the case of Mauritius, the Prime Minister actually on the 18th of March announced that Mauritius had its first 3 cases, 3 COVID positive infection on the 18th of March. And then on the 20th of March, 2 days later, the authorities announced a national confinement, meaning that all services would be locked down, except very few essential services. And later on, even those basic services like supermarket, shops, all of these were locked down, and on the 22nd of March, a national curfew was imposed. Now, when this decision was taken, Muslim leaders, some of them who have been in touch with the authorities and politicians, also took the decision to lock down mosque. So mosques were locked down, congregational prayers were cancelled, and all other services of the mosque were cancelled. Now, when this decision was taken, the data that we had was that only 3 persons were tested, were infected with COVID-19 in Mauritius. Now, based on the Islamic principles of decision making, when we look at these data, and even now, some 7 weeks after, the data tell us that in Mauritius, we have, as today, 26th of April 2020, we have had 331 positive cases of COVID-19. So 331 cases of COVID-19, out of which 295 persons have been treated and have recovered. So they are okay. So out of 331 cases of COVID-19, 295 of them have recovered and they are okay. So they are no longer suffering from the disease. 9 people have died. And so, when we look at these data after 6 weeks, when these decisions have been taken, this means that 90% of the people who were infected have recovered. They are okay, they are fine, they no longer have the disease. And only 2.7% of the people who were infected have died. Now, when we have to take a decision, in all scenarios, when we have to take decision, we take decisions on the balance of risk and probabilities. Now, if you have a situation where, a problematic situation where 90% of the people within that problem have been able to overcome the challenges, overcome the risk, and are okay, and only 2.7% of the people have actually suffered the consequences, or the 2.7% of fatalities, and you have to make a decision. You have to make a decision. Now, what do you have to do? What do we do normal? Do we make the decision based on 90% probability or on the 2.7% fatality? Now, Islamic law tells us that Al-Qalil al-Nadir la hukma lahu. Whatever is little, rare, insignificant has no bearing in the law. So the law makes decision based on what is prevailing, what is overriding, what is the majority, and not on what is rare, insignificant occurrences. So here you have 2.7% people who have died and 90% of people who have recovered. So when you have to take a decision whether to lock down the mosque or whether to not to lock it down, so the decision should be made on the basis of what is overriding, the 90% and not on the 2.7%. Now, this is the data that pertains to COVID-19. And our brothers here need to understand something. COVID-19 is an infectious disease. In the public health jargon, this is called communicable diseases, and out of the communicable diseases, COVID-19 is one of those diseases which we call the respiratory system diseases. Now, if we look at the data, the fatality data, the death data in Mauritius, the latest data that we have is for 2018. In Mauritius, out of a population of 1.2 million, every year we have a death. We have a fatality number of 10,521 deaths every year. So generally 10,000 deaths every year in Mauritius. Now, out of these 10,521 deaths, respiratory diseases account for 11.7% of it. So every year in Mauritius, 1,233 people die of respiratory diseases like COVID-19. Other respiratory diseases include common cold, flu, and other diseases. Now, out of these 10,000 persons who died every year in Mauritius, 1,200 of those die of respiratory diseases. Now, out of these 1,200 persons that die of respiratory diseases, 242 of them die of infectious diseases. Now, what does that mean? It means that in Mauritius, every year, 200 people will die of infectious diseases, of infection, like COVID-19. Now, not out of these, but rather, this is the number of people who die. But every year in Mauritius, do you know how many people got infected with infectious diseases? The number is 104,000 people are infected every year in Mauritius with all sorts of infectious diseases. Now, this makes an average of 860 persons every single month. So 800 persons in January, 800 persons in February, 800 persons in March, 800 persons in April. So 800 persons every single month on average get infected with infectious diseases. Now, if I take this number and I break it down in terms of the percentage population, Muslim population in the country, this gives you the number of 146 Muslims every month get infected with infectious diseases in Mauritius. And out of these 860 persons who are infected every month, out of these 860 person, every month 20 person will die from these diseases. So, but to sum it up, every month in Mauritius 800 persons get infection. Out of these, 20 people will die of infectious diseases every single month in Mauritius. Now the question here is, when we've been talking to the mutawallis, imams, Maulvis, etc., when decision was taken to lock down mosque, cancel prayers, etc., the reason has been that we are doing this to protect life, because people, if when people are infected, they will die. So we are taking this decision to lock down the mosque, to cancel Jamaat prayers, to cancel Taraweeh, to cancel Itikaf. All these decisions were taken because we want to protect the people from COVID-19 infection. And bear in mind that the decision was taken when there were no deaths, and now we have 9 deaths over 3 months. 9 people have died in Mauritius. If we forecast this for the whole year, this will give us 36 deaths. So here on the one hand, we have 800 infection, 850 infection per month. We have 240 deaths from infectious diseases every year. And here we have only 9 deaths so far, which at most will get us to 36 deaths in a year. Now the question here is, to all our religious leaders, to all our brothers who are listening to us, if you have taken a decision to protect life, to protect people from infection, when you have only 9 people have died, what are you going to do when you have infection where 240 people will die? Are you going to open the mosque and let the mosque open and let people catch infectious diseases and then die? 240 of them will die this year, out of which 41 of them will be Muslims. So this is a serious question. And the thing is, those infectious diseases, you have diseases like common cold, flu, influenza, tuberculosis. And all these diseases, just like COVID-19, these people will get the diseases in the mosque. When they pray on the carpet, they will catch those bacteria, viruses on the carpet. When they prostrate on the carpet, when they use the towel at the wuzukhana, they will catch these bacteria and these viruses. When they shake hands, when they talk to people, when they rub shoulder to shoulder, all these diseases, all these people will catch these infectious diseases in all these situations when they go to the mosque. 240 people will catch, 240 people will die of these infectious diseases. Now this puts us into a very tricky situation. If you are willing to protect life and 9 people have died, you close down the mosque to prevent other people from getting infected. What are you going to do when 240 people will certainly die of the same infectious diseases? If we follow the logic of closing down the mosque to protect life from COVID-19, which is infectious, then we will have, the only solution that we will have to do is to keep closing down the mosque, cancel prayers, cancel Jamaat prayers, ban Jummas, to prevent 240 people from dying of other infectious diseases. Is that what are we going to do? Is that what we will do to prevent people from getting infections? And as I told you, 104,000 people will get infectious diseases this year in Mauritius, maybe even more, and 860 people will get infected every single month. Are we going to keep closing down mosques and lock down mosques just to save life and to prevent these infections and to prevent these deaths? I don't have the answer. Now, if you want to know what we are going to do, you would have to ask your mutawallis, your imams, your da'is, your molvis, your maulanas, and tell them these are the facts, these are the figures, what are we going to do? And you also need to ask your MPs, your member of parliaments, your ministers, etc. Ask them if these are the facts and if these are the figures. 104,000 people are going to get infected, 860% every month, 240 people will die of infectious diseases. Are we going to keep locking down the whole country, impose curfew, prevent people from moving about just to protect life? What are we going to do in this case? These are the facts, these are the figures. And the most worrying thing is that if this disease, the COVID-19, eventually turns out to be a seasonal virus, meaning that every season in winter this virus will come, so next year when this virus will come again, what are we going to do? وآخر دعوانا, and thank you for your attention. Wassalamu alaikum wa rahmatullahi wa barakatuh.